the medical school, I think from our pre-med as well. So if someone is working on research, but the thing I'm trying to explain here is again, someone try to sorry trying to explain that it's something that everybody is seeing, but nobody has thought about. Basically, you need to understand that when we are working on a research, we are trying to uh, uh, present to the people something new, something interesting, something that someone has worked on, but they haven't looked at in this way like you are looking on it. So basically, we're trying to modify old concept, old things, and introducing us and something new to the research world. So basically, we have been hearing research from a long time, and the concept is that it's not something very I don't know, when someone just tells about research, everyone gets really in a surprise and thinking what's uh, something unique. But it's really simple. It's really easy to do this, and you can do this, and you need to understand that the research that's doing in clinical trials and doing in the lab work, that's different, and the research that a medical student, medical graduates do, that's different. So I'm going to describe everything one by one. So it's the most easiest definition that a research will describe is that everybody is seeing. Basically, for example, everybody is seeing that oncology or cancer exists, but nobody has thought that specific topic that every kind of diagnostic tool of that cancer could be given in one paper. So it's something that everybody's saying, but your mind is telling you that I can describe and to do to the people in a new, more unique way. So that's the most easy definition. Okay.
Sorry to interrupt again. We can see the blank screen, but I'm not seeing any of your slides.
Why is this happening?
Like we can see the Zoom window, but not the window of
Yeah.
your presentation.
Sorry guys, why is are you guys are able to see now?
Yes.
Yeah, just now
Yes,
we can see.
everything.
The types of medical research, you guys are able to see that?
Yes.
Yes.
Okay. Okay. Sorry guys, I don't know what's happening. Okay.
Now,
Do let me know if you're not able to see, because this is a different slide and I have to go towards that. I'm hoping that you guys are able to see types of medical research and things right here. It's if you are, I'm going to move forward. Yeah. What happened?
No, we can see that.
We can see it now. Yeah. Okay. So basically, you need to understand when you're thinking about research, there are two types of research. Can you mute? So, Dr. Tanvi, do you want to say something?
No.
You need to understand that there are two types of research. One is a qualitative research and one is a quantitative research. Hello.
Yeah, we can hear you.
So why I'm trying to mute? Please kindly mute. Okay. The reason I'm muting is that the voice is really interrupting. If you guys want to ask something, you can open, and I'm open to hear any question. Types of medical research, you need to understand when you're thinking about research, there are two sides of research. One is a qualitative research and one is a quantitative research. Qualitative researches are all those researches that doesn't involve any kind of statistics, any kind of data analysis, any kind of, that the extraction of data from the patients and looking at different types of, sorry, different types of any kind of statistic. That's that in which the meta-analysis comes, because in a meta-analysis we are basically taking different clinical trials. We're taking the data of the patients in it, their BPs, their ages, the populations, and then we're pooling all the data, we're analyzing them, and we're giving the results. That's a quantitative research. If you guys I don't know if you in the steps, that's really important. Quantitative means number or data that's involved. Okay. In qualitative research, in which a narrative review comes, then there isn't involving any kind of a data analysis. it involves all kind of literature in it. So basically, what we are dealing in a qualitative research is that we are dealing with different literature that has been published, or any literature that we can found, and we are working on that. So the difference between the quantitative and qualitative research is that the number of statistics and the literature or any kind of written or writing or any kind of like that. So that's a very big difference between doing a quantitative, because all the clinical trials, all observational studies, all meta-analysis, that type of research is where patients and all different kinds of statistics, and you have to pool the data. Everything comes in a quantitative research. That requires a different kind of approach, a protocol. That's different. But in the qualitative research, it's a different thing, because that's not involving any kind of statistics, any number of population, anything like that. So it's easier to do qualitative research. Quantitative research takes that time, but of course it's harder to do quantitative research and has higher value in research. But again, what I'm trying to describe to you guys, that whenever if I'm talking to a mentee, he's like that he wants to do a meta-analysis, and he's like, this is the best type of research. Do not think like that, because when you're in the US here, because I'm here and I'm talking to doctors, I'm connected to doctors, they do, of course, it matters to them, the meta-analysis, but they respect every kind of research. They want to know how much you are hungry to work on it. So do not take any kind of research that this is a smaller kind of research, I don't want to do that. The thing, you should always enroll in every type of research and try to get your name in it, because they want to know how much active you are. So that's never ever think that this is a smaller research, I don't want to do it, this is a bigger research. Once you're on a assistant professor level and something like that, that's of course something that's a different thing, and you can ignore the reviews and move on only any statistic. Sorry guys. Yeah. So if you guys have any question related to the qualitative quantitative research, you can ask me, and then I'll move on. And if not, I'll be moving on. Okay. I hope you guys are able to understand the difference between a quantitative and qualitative research. Is there any question, guys? You can also ask in the chat box. Okay.
Dr. Muzammil, I have one question.
Yeah. Yeah.
Can I see this recorded session after this session?
The recorded session, the team, I don't know, they are saying that uh, they're only allowing to share to those that are not able to take it. I would really prefer that you guys are take notes, because that would be better. But these are really basic things, and I don't know, I'll ask them. If they say yes, I'll share the research, but I would really prefer that you take notes of yourself. But it's not something, take notes is something to understand. I'm really being honest. Try to understand rather than, indulging yourself. And once you're, starting the work, you'll get to understand one by one everything. So right now, just try to understand what I'm trying to explain. Try to, get into the system, like how this works for you as a graduate, as a medical student, as a math applicant, and how you can do research. So I would really
Because
ask you, yeah, okay.
because there is some interruption in the voice, maybe due to my internet connection. So that's why I just missed
Okay.
some words or some
I'll
concepts.
I'll ask them if they can share the record session. Okay, that's not a problem.
Thank you.
Okay.
Thank you so much.
Okay. So I wanted to describe types of medical research. So there are different types of medical researches. When you're starting a research, you should know that these are type of research that one can perform. And I also have this pyramid that I'll let you know. Okay. So basically, I'm starting with a meta-analysis. What is a meta-analysis? I think you guys have heard of meta-analysis. If someone hasn't heard of meta-analysis, I'll be explaining you what is meta-analysis. Basically, in a meta-analysis, what we're doing is that we are checking that different clinical trial that has been published. So what happens is that a doctor wants to check that if this drug works or not on a patient, and what's the outcome. Okay, so he does a randomized clinical trial. A randomized clinical trial is that the patients are randomized. Even the PI knows, I think, but the patient doesn't know what type of medicine he's taking, because they make two groups. One is an intervention group, and one is an observational group. So what happens is that we are checking a specific drug or any specific thing we are checking on a patient, and we want to check that if that a drug is effective or not. That's it. That's a clinical trial. And I think you must have heard that different